Hi, my name is John Adams. I'm from Toronto, Canada, and I knew nothing about rare diseases or newborn screening or phenylketonuria, also known as PKU, until 26 years ago. Our youngest child was born, and we got a phone call to come on back for another blood test. And then we got a phone call to say, oops, you have an appointment tomorrow at the PKU clinic. Bring your wife, bring your baby. Be prepared to spend the day. Never had heard of PKU until we got that phone call. PKU, the good news is, for 50 years or more, in most of the United States and Canada and several other developed countries, every baby born has been tested for this rare metabolic disease. It's not life-threatening, it's only brain-threatening. If a baby is born with PKU and they're fed a regular diet, there's something in protein which will act as a poison on their brain, including mother's breast milk. And over the course of the first year of life, that baby will lose about 1 point of IQ a week and will be rendered unable to walk, talk, or even be toilet trained. So it's a fairly significant thing to know about. And the problem is the damage is happening with very little in the way of signs or symptoms. Babies starts to miss some developmental milestones, but babies do that, and the neurologic damage is irreversible. So that's why the newborn screening, a modern scientific miracle, started in the 1960s, so that every baby would be tested for PKU in order to find the 1 in 12,000. Right, and on that basis, other diseases that are also insidious, they're present in a newborn, such as cystic fibrosis or sickle cell disease. I mentioned 2 that most people have heard of, and a bunch of others that most people have never heard of, because they're so rare, are being tested for from 5 drops of blood. And now you can also test for whether a baby actually has hearing loss on the 2nd day of life. Now you can also test whether or not a baby has an undiagnosed heart defect, which could threaten the baby's life within a matter of days. And you can do that on the 2nd day of life as well. So that's newborn screening isn't for every disease, and it isn't for every condition. It isn't for every rare disease or disorder. It is for the subset of disorders where the threat to the baby's health is present, but there aren't clinical signs or symptoms. So the best doctor, the best nurse, the best mom, the best dad, you haven't got a fighting chance to prevent harm. So you need to be screening the population to find these cases for early detection and intervention.